Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Every 6 minutes, a patient at Mayo Clinic needs a transfusion of blood or blood products, and that's just the Mayo Clinic in Rochester, Minnesota.
Wow.
Now, it might be a child with leukemia or maybe an accident victim who has lost a lot of blood. And for a whole host of reasons, blood donations are a constant need around the country.
In an effort to increase the pool of potential donors and to coincide with American Red Cross recommendations, the Mayo Clinic Blood Donor Program has updated eligibility guidelines for donors who have had some previous cancer diagnoses.
Maybe you can donate now.
Maybe.
We'll see.
Here to discuss guidelines for being a blood donor is Dr. Justin Kreuter. Dr. Kreuter is the medical director for the Blood Donor Program at Mayo Clinic. Welcome back to the program, Dr. Kreuter.
Thank you for having me and highlighting this topic.
Yeah, Dr. Kreuter, nice to see you. And there's several reasons that we've had you on the program previously, but now there's another reason, and it's good news for some people who want to be donors.
Absolutely. We're excited. There's a whole host of donors that have been loyal blood donors through the years, and then they've come across a period of bad luck in getting a cancer diagnosis. And this is a way that we can bring them back into our community of active blood donors sooner.
Because previously, if you were diagnosed with cancer, then going forward, you cannot be a blood donor. But no longer.
No, well, it depends on the type of cancer.
Okay.
And this is also going to depend on your local blood collection center as well. And so what we've done here is homogenize ourselves with what the Red Cross is doing. So we looked at this issue of what's the risk? When we're talking about blood donors, we're concerned obviously about the health of the donor, and we're also very concerned about the health of the recipient. In this situation of a history of cancer diagnosis, non-blood cancer, so not lymphomas or leukemias, it really is, there's no data to say that there's any risk to the recipient. So it's really based on the donor's health. We want to make sure that our blood donors have an ample time to recover from their cancer treatment. And so that's why we've switched from used to be a 5-year deferral before we'd let folks come back in to say, you know what, after 1 year, if somebody's completed treatment and they've been healing that whole time, it's probably fine to have them come back in and donate.
So you're saying that there is no evidence that a person who has had cancer previously could give someone else cancer through a blood transfusion?
That's correct. There's no cases that have ever happened of that, and certainly, we have blood donors that have given that then, quite soon after, actually,
Sure.
sometimes come down with a diagnosis, and so there's been plenty of situations where, unbeknownst to us, there was a recent cancer diagnosis in a unit that was transfused, and there's never been any case reports of some recipient of a blood transfusion getting cancer.
Not yet for leukemia or lymphoma patients, though, for those survivors.
That's the way we're moving. So that's what the national practice is, and so we're moving towards this step. It holds true what I say for people who have been diagnosed with leukemia or lymphoma. There still has not been any cases of those being transmitted to a recipient, but we're working towards that direction. We want to make sure that we still give patients ample time to heal. We do know that there can certainly be relapses, and we want to make sure that we're not drawing blood from a patient or from a donor who then needs it 2 weeks later.
So Dr. Shives had said every 6 minutes transfusion is needed here at the Mayo Clinic campus in Rochester, Minnesota. That seems like that must mean a huge need that we have.
Yeah, absolutely. The need across the country really is constant, and that makes it a struggle. I mean, if you have a constant need, it sort of fades into the background, which is why it's so wonderful when programs like yourself highlight this, and this brings it back into the forefront of folks' mind. And so based on this new criteria that we here are doing at the Mayo Clinic Blood Donor Center, I guess I'd encourage listeners to contact their local blood collection center to see if they are eligible to donate.
So review for us the criteria for being a blood donor.
Well, there are some things that are set by federal law. You have to be at least 110 pounds to donate. You have to be in good general health and feel well and healthy on the day of donation.
How old?
So that's also going to depend on what state you're in. So everywhere across the U.S., once you're 17, you're eligible to donate. And in some states, you can donate at age 16 with parental permission. So that's going to be something also that varies across the country.
Do some blood banks pay for you to donate?
No, and
Really?
that separates us from the plasma donation centers. Viewers may be more familiar with that. So if you're donating plasma at those centers, they do pay for donations, but never for anybody who's donating whole blood, packed red cells, platelets, any of the other sort of donation process. People that are frequent plasma donors at plasma centers, it's actually a different industry. And so they are allowed to pay, but because our blood products have to be used fairly rapidly for public health, it's safest if it comes from a donor who is donating out of the goodness of their heart without remuneration of any kind.
Some of the folks who donate blood on a very regular basis are the records that have been set are going to be safe, because what I've understood is over the last couple of years now, it's getting changed to you have to go longer in between donations. Is that right?
So this is something also that we're a little unique here at Mayo Clinic. So across the country, for whole blood donors, which is the most common kind of blood donation, you have to wait 8 weeks, and that's mandated by federal law. Here at Mayo Clinic, we've been, for the time being, asking donors to wait 12 weeks in between donation, and that's because there's a lot of focus on donor health. We certainly don't want to take regular donors and make them iron deficient, anemic, and make our donors become patients in the process of trying to help others. And that's why we've really taken a conservative approach here of waiting 12 weeks in between. We're actually doing studies to see how effective this is and if this is the best way forward. This is actually a very hot topic in my world of blood collection centers, and we're really looking forward to getting data to understand what's the best way going forward.
All right, so you mentioned that you can potentially get paid to be a plasma donor. What do you mean? Tell our listeners what you mean by plasma.
So there's a separate industry. So plasma donors are donors that come in frequently, and when they come in and donate, they do many of the same things that we were talking about when people donate blood. They're going to take off those infectious disease markers. We test all of our blood donors for HIV, hepatitis, etc. In the plasma donation world, they take that donation and they freeze it and they kind of put it in this hold area. And when the donor comes back, then they come back frequently. But when there's a 6-month period and they've got 2 negative infectious disease tests for 6 months, they will then take that plasma that's been on hold and use it to make factor concentrates. So, for example, drugs that treat patients that have hemophilia, that's how we get some of those factor concentrates if they're plasma-derived. Albumin, something else that we use quite a bit in surgery as well.
So plasma, you mean everything but the blood cells. You don't take the blood cells.
Exactly. In plasma donation, plasma is the usually straw-colored, watery fluid that really is what our cells are swimming in our veins.
Ah, perfect.
We have 30 seconds left. How can listeners become donors?
Listeners should investigate whether they should be donors. So listeners should definitely reach out and call their local blood collection center, find out if they are eligible to donate, or find out if they're not eligible to donate. Certainly another huge thing is looking to see how they can help promote blood donation in their community.
All right, and call soon, because it's not too far off where somebody's going to come up with an artificial blood, right? And then you can be here full-time with us.
I'm looking forward to that.
All right, Dr. Justin Kreuter, Medical Director of the Blood Donor Program, Mayo Clinic, Rochester. Thanks for being with us.
Thanks so much for highlighting this, Tom.